Hi, I'm Dr. Alex Koo,
Hi, I'm Dr. Royal Park.
coming to you from Restore Anti-Aging by Doctors.
In this segment, we'd like to discuss the data that's out there that supports the use of Gainswave for treatment of male sexual performance.
Using Shockwave to treat erectile dysfunction has been going on for maybe about 8-10 years in Israel and Europe and South America, but a lot of the science is still new. And we keep on the cutting edge. We look at the latest data, we look at the latest study, and we constantly modify what we do in order to maximize the efficiency of the treatment. For instance, one of the newest study from coming out of Greece that have shown that who have had 6 sessions of shockwave treatment have about 65% of them responded. People who had 12 sessions, 70 some percent of the people responded. People who had 18 sessions, 80 some percent of people responded. So it seems that there actually is a dose response curve.
I think what is important to realize is that, again, this is very new technology, so the data that's out there is not very robust. The study that I looked at recently was a meta-analysis of 7 clinical trials where they looked at the efficacy of shockwave treatment for erectile dysfunction. And the conclusion was that the majority of men did respond. They have a specific scale that they look at to see improvement in quality of erections, and they saw a statistically significant increase in this score in men who received the treatment versus those who did not. So there is data out there, but again, it's very important for people to understand that this is something that's new. So it's not that there are protocols that are set in stone. This is why, again, we'd like to look at it as individualized treatment and to make sure that what you need is what you will get.
So what is important is to be treated the right way with the best evidence currently available. There are people out there who don't understand urologic anatomy and who put the shockwave at the wrong places. There are people who I heard of who use shockwave energy so strong that it's incredibly painful, and as urologists, we worry about this in the long term causes scarification of the penis. And so for both safety and efficacy, it's vitally important to go to the guys who know the anatomy, who know the science, and who is able to have the experience and the judgment to give you the best treatment.
So when we treat men, obviously we want to have a goal in mind, and the man who comes in seeking treatment has a goal in mind. That's why it's very important to set the expectations. Obviously, we can't promise, hey, you're going to be like you were when you were 18, where getting an erection was when the wind was blowing on your area. That's not going to happen. Let's be realistic. But what we can expect based on our own clinical experience is that you will improve. So, Alec, in our experience, in our practice, what kind of results have we been seeing?
So we've treated more than 100 patients now, and just in monitoring our first 100 patients, we probably have a 80% or better response rate, meaning that 80% of the men, the erection is actually better after the treatment.
So other than just offering the shockwave treatment, is there anything else that you think is important to offer the men who are coming here for treatment?
We're urologists, and we've treated erectile dysfunction all our life. And we offer the full spectrum of treatment. And for the lightest severity disease, may not even need Gainswave, or Gainswave could be an option. And for people who have the most severe form of erectile dysfunction, I'm not gonna lie, shockwave treatment may not be appropriate. And there are other treatments that may be more effective. So for us, this new shockwave treatment is a great part of our armamentarium, but there is a full spectrum of treatment that we offer, full spectrum of diagnostic tests, and we really tailor the treatment to the individual. So when you come to a board certified urologist for treatment of erectile dysfunction, we offer the full spectrum of treatment. Shockwave treatment is only one of them, and we offer from the least severe type of treatment to the most aggressive erectile dysfunction treatment. We do penile implant surgeries. We do penile injections. Hopefully, that would not be necessary, but if necessary, that's what's appropriate. That's what we do. And not only that, we can combine modalities because we do treat with medications and nutritional supplements. We combine that with shockwave treatment, and we believe we get better results with that as opposed to treating it with only shockwave treatment.